Does a person become diabetic by eating sweets? Does taking insulin mean diabetes is at end stage? And can diabetes be cured? Hello everyone, I'm Dr. Salima Yousuf, general physician with special interest in diabetes at Royal City Clinic, Jleeb. In my clinical practice, I often come across a lot of patients who have myths, assumptions, or questions with regards to diabetes. Today I will share a few of them with you. So a person does not get diabetes by eating sweets. Normally when we eat food, the glucose level in our body rises, and in order to utilize this glucose for energy, we require the help of insulin. Insulin is secreted by the beta cells of pancreas in our body. In a non-diabetic person, this mechanism is well maintained because both insulin and glucose go hand in hand. However, in a diabetic individual, the production of insulin is hampered. So either the body does not produce enough insulin, or even if the body does contain insulin, somehow it doesn't work anymore. So in this case, the levels of glucose keep rising, the excess spills in urine, so giving rise to symptoms of excessive urination by patients. This makes them thirsty, so they have increased thirst. Their mouth becomes dry. Some of them feel very hungry. They become dehydrated. They also lose weight. They feel fatigued, and this gives rise to all the symptoms of diabetes that we commonly see in patients. Of course, some patients may not have symptoms of diabetes, especially if they are pre-diabetic. Now, the reason we advise patients not to consume any sweets or carbohydrate-rich food is because already the level of glucose is so high in their blood. So this is going to make the problem worse if they consume high carbohydrate food or sweets and foods as such. Question number 2. If you are a diabetic who has recently been diagnosed of diabetes, or if you have diabetes from a long time but you have uncontrolled sugars, is it advisable for you to borrow your relative or your friend's medicines because their sugar levels are very well controlled with those medicines? So the answer is absolutely no. It is not advisable for you to borrow or take medicines from your friends because their sugars are controlled. Normally, when doctors prescribe medications for their patients, especially for diabetes, it is individualized. It is customized for each patient based on their blood report and several other factors that we have to keep in mind. We have to check if they have other comorbidities, such as high blood pressure, cholesterol problems, any impairment of kidneys. If for any reason the kidneys are impaired, a lot of medicines cannot be prescribed to them. Hence, it's very crucial for you to make sure that you seek your doctor's advice personally and not depend on your friends or over-the-counter medicines from the pharmacies or advice from the internet, etc. Assumption number 3. Many patients feel that taking insulin equates to last stage of diabetes. This is not true. In fact, insulin can be started as the first line of treatment for diabetes in certain cases. It depends on the level of blood sugar control and other factors which, of course, your doctor will decide for you. Not taking insulin or having the fear of taking insulin is basically an inertia patients have towards taking daily injections, sometimes once, twice, or even up to 3 or 4 times a day. And while it's true that it can be cumbersome, but the truth of the matter is taking insulin sometimes becomes crucial, especially depending on the level of the sugar control and at the stage of diabetes. Perhaps the patient had probably tried a lot of treatment on oral medications, or his level of blood sugar is at a point where insulin becomes mandatory. Scientific evidence also proves that insulin gives very promising results, and possibly the best achievement of glycemic efficacy is seen with insulin. So viewers, I would like to request you that if your doctor thinks that insulin is the treatment for you at that point, please don't hesitate to try it out. Make sure you follow your doctor's advice all the way. Question number 4. Can herbal medicines be a substitute for diabetic medications? A lot of people feel that when they take herbal medicines, their blood sugar levels are very well controlled. And why is there a need then to take allopathic diabetic medicines? But the fact is, herbal medicines can only be a supplement to diabetic medicines and not a substitute, which means that you can take your herbal medicines alongside your diabetic medication. But please do not stop taking your diabetic medicines, because we are aware of all the complications diabetes can cause in the long run. Moving on to question number 5. Can diabetes be cured? A lot of my patients fear starting or initiating the treatment of diabetes because they feel they have to continue the treatment lifelong. On the other side, there is also a misconception that diabetes can be cured or reversed. So the truth is, diabetes can be well controlled and managed. Yes, there can be a period of remission which can be achieved, whereby patients may not be taking diabetic medications, and this can be achieved through lifestyle changes, losing weight in case of obese and overweight individuals. However, in the long run, the sugar levels in blood may increase again, which is why it is very important for you to regularly, periodically meet your doctor for visits and follow-up check every 2 to 3 months to make sure that your sugar levels are at bay. The aim here is to keep sugar levels well controlled in order to prevent or prolong the onset of complications that we frequently encounter with diabetes. As you know, diabetes can give rise to complications starting with cardiac diseases related to the heart, frequency of heart attacks, brain strokes, frequent leg infections, cellulitis, or diabetic foot ulcers leading to amputations of lower limb, eye problems and disorders such as retinopathy, blindness, erectile dysfunction in men, and kidney diseases leading to kidney failure, and so on. So, dear viewers, I hope I was able to clarify at least some of the assumptions you may have had with regards to diabetes. My request to every one of you out there is to go get yourself screened, to be more aware of your health, and to live a better quality of life. Go make it happen. Thank you so much.